Imagine this for a second. What if your knees could, like, pull up a chair right now and actually talk to you? What would they even say?
Huh. That's a great way to think about it. Would they complain? Or maybe just sigh contentedly?
Exactly. Would it be about that morning jog?
Yeah.
Or maybe, grumbling about sitting too long? Today on The Deep Dive, we're going to try and tune into that conversation, the one our knees are always having, even if it's silent.
Decoding those messages.
Yeah, think of this as like your shortcut to understanding what all those little twinges and pops might actually mean. It's about giving you the power to really look after these amazing joints.
And we've looked at some really interesting material for this, focusing specifically on interpreting those signals and exploring some natural ways to keep them happy.
It's amazing how we usually only pay attention when they start complaining, right?
Yeah.
They really are the unsung heroes, the workhorses of our bodies.
Absolutely. Total engineering marvels when you think about it. Seriously. They're the largest, most complex joints we have. Connecting the femur to the tibia, with the patella there for protection, and the workload. It's pretty staggering.
It really is. Something like 8,000 steps a day on average.
Yeah, and absorbing forces, get this, up to 5 times your body weight when you're active. It's kind of mind-blowing.
Wow.
One of the pieces we looked at actually personified the knee, starting with, "Hello there, I'm your knee joint."
Yeah.
It just instantly makes you think differently, doesn't it? Like it's a partner trying to communicate.
It really does. And that simple perspective change, well, it highlights the main idea, right? These joints give us constant feedback. Understanding that is just so key for staying active.
Okay, so let's get into decoding this knee language. First up, those creaks and crackles. You bend down, maybe hear a little pop or crackle. The sources call it crepitus. One source described it as the knee saying, "I'm getting a bit dry." What's actually happening in there? Well, interestingly, those sounds, they often come from tiny air bubbles popping in the synovial fluid that's the joint's natural lubricant, or sometimes it's just the slightly rougher surfaces of the cartilage gliding over each other.
Okay.
But the key thing, and this is important for listeners, is that the sound alone isn't necessarily something to panic about.
Right.
But if you get those noises with pain, then yeah, that's definitely a signal to pay closer attention. It might mean things aren't as well lubricated or the surfaces aren't quite as smooth as they could be.
So noise plus pain, not okay. It's like an early whisper, maybe.
Yeah.
Like that door hinge needing a bit of oil.
That's a really good analogy, actually, yeah. A gentle reminder about the joint's internal environment.
Okay. Now, what about a different kind of feeling? That sharp pain, maybe when you bend or straighten your knee, almost feels like something's physically caught. One source put it as the knee saying something's in the way.
Yes, and that specific type of sharp, localized pain really does suggest there might be a physical, mechanical blockage inside the joint.
Like what kind of blockage?
Well, the sources point to a few possibilities. Things like maybe a torn meniscus, that's the C-shaped cartilage pad acting as a shock absorber, or maybe a little lewd piece of cartilage floating around in there, or potentially other structural issues. That feeling of something being in the way is quite literal.
Ouch.
Yeah.
Like a little pebble jamming the works.
Yeah.
Okay, next. The dull, aching pain, the kind that sort of settles in maybe after a busy day or some activity. The sources frame this as, "I'm wearing down." Sounds like classic wear and tear.
That's often exactly what it is. That persistent dull ache is frequently linked to the cartilage thinning out, the protective cushioning wearing down. That's often an early sign of osteoarthritis.
Right.
And as that cushion gets thinner, the bones can start to rub more closely together, leading to that ache. Now, the sources do say this can be a natural part of aging, but, and this is key, it's not necessarily inevitable. You can take steps to slow it down.
Okay, that's good to know. That end-of-day ache isn't just something you have to live with. What about stiffness? That feeling when you stand up after you've been sitting for a while. One source suggests the knee is basically saying, "I need regular movement." Why does sitting still bother them?
It comes back to that synovial fluid again. When you're still for a long time, that fluid, which lubricates and nourishes the joint tissues, it doesn't circulate as well.
Okay.
So the knee is essentially asking for movement to help pump that fluid around, keep everything, supple and fed. The machine needing oil analogy works well here too.
Got it. Keep the fluids flowing. Okay, let's talk about something more visible. Swelling. When the knee puffs up, a source said this is the knee declaring, "I'm inflamed and need attention." what causes that.
Yeah, swelling, that buildup of extra fluid, is a really clear sign of inflammation. And the triggers can vary. Like the sources mentioned, it could be a sudden injury, maybe an infection, or even just overuse from repetitive activity.
So the fluid is protective somehow.
Well, it can provide a bit of temporary cushioning, yes, but mainly it's a strong signal that something's wrong and needs looking into. The knee's basically saying, hey, something irritated me. I'm trying to protect myself, but you need to figure out what's up.
Right. A definite call for investigation. And the last immediate sensation, heat around the joint, interpreted as, I'm working on repairs. What's happening when it feels warm?
That warmth you feel, that's usually down to increased blood flow to the area. The knee is actively bringing in the body's repair crew, basically.
Ah, sending in reinforcements.
Exactly, delivering nutrients, immune cells, everything needed for tissue repair. Now, it's normal after an injury, but as one source points out, if it's warm persistently without an obvious injury, that could signal ongoing inflammation or maybe even an infection. So another signal not to ignore.
Okay, so those are the more common sort of day-to-day signals, but the sources also flag some really crucial early warning signs, things we definitely shouldn't ignore. First one, instability. That feeling like your knee might just give out. The knee saying, I can't support you reliably. That sounds pretty scary.
It really is. That feeling of wobbling or like it might buckle underneath you, that's a significant red flag. It strongly suggests there could be damage to the structures that stabilize the knee, maybe the ligaments, those strong bands holding it together, or perhaps a major meniscus tear.
And the advice is?
Definitely don't just push through it. That's critical advice from the sources. You could cause even more damage.
Makes sense. Don't try to power through instability. What about changes in range of motion? Like you suddenly find you can't fully bend or straighten your leg. The source suggests the knee is saying, I'm protecting myself.
Exactly right. It's not the knee being stubborn, it's a protective mechanism. If moving fully causes pain or risks further injury, the knee will instinctively limit that movement.
So it's a signal that something's physically stopping it or hurting it.
Precisely. Something is hindering its normal function, and you shouldn't try to force it.
Okay. And the last early warning, and this one sounds particularly serious, pain that wakes you up at night. The knee basically screaming, this is serious. Why is nighttime pain such a big deal?
Well, nighttime pain is significant because it often indicates a more advanced level of inflammation or degeneration inside the joint. When you're resting, there aren't other things distracting you. So if the pain is still intense enough to wake you, that suggests a pretty substantial underlying problem.
So it needs checking out professionally.
Absolutely. The sources are very clear on this. It's a strong indicator that you need a proper medical evaluation.
Right. These SOS signals are really vital to know. Okay, let's shift gears. What are our knees actually asking for? What can we do to support them naturally? First up, seems obvious but important, weight management.
Huge factor.
Yeah, one source had this striking stat. Every extra pound of body weight adds 3 to 5 pounds of pressure on your knees. So when the knee says lighten my load, it really means it.
Oh, absolutely. That multiplier effect is no joke. And the flip side is really encouraging for listeners. Losing just 10 pounds, that can mean 30 to 50 pounds less pressure with every single step.
Wow, 30 to 50 pounds less.
Yeah, over a whole day, that adds up incredibly fast. It makes a massive difference.
That's really motivating. Okay, next, exercise. The message is keep me strong, but be smart. So it's not about avoiding exercise altogether.
Definitely not. Strong muscles around the knee, the quads, hamstrings, calves, they act like a natural brace, providing crucial support and stability.
Okay.
But the be smart part is key. It means avoiding, excessive high-impact stuff, especially on hard surfaces like concrete, which can really pound the joints.
So what kind of exercise is good then?
Well, the sources suggest things like swimming, cycling, using an elliptical machine. These are great because they strengthen those supporting muscles and give you a good cardio workout, but with much less impact on the knees themselves.
Right, build the support team without hammering the joint. Got it.
Yeah.
Now, how about feeding our knees? Nutrition for joint health. The message. Feed my structures. What kind of nutrients are we talking about?
Yeah, it's interesting how specific nutrients help. Omega-3 fatty acids, great for fighting inflammation. Vitamin D and calcium, obviously important for bone structure around the joint.
Great.
Vitamin C is needed for making collagen, which is like a key building block of cartilage.
Okay.
And don't forget antioxidants, lots of colorful fruits and veggies. They help protect the joint tissues from damage. So a really balanced diet helps provide all those things.
It's like bringing in the construction materials on the maintenance crew. And something simple we might overlook. Hydration. Knees are saying, keep my fluid fresh. How does water help?
Water is absolutely essential for healthy synovial fluid. Remember that lubricant and shock absorber? Well, being properly hydrated keeps that fluid at the right consistency. Nice and slippery, basically.
Yeah.
If you get dehydrated, the fluid can become less effective, potentially leading to more friction and wear over time. Simple, but really effective.
Keep the oil topped up and clean.
Makes sense. Lastly, under natural support, natural anti-inflammatories, helping the knee fight inflammation. What are some examples?
The sources mentioned a few popular ones. Turmeric, especially with black pepper to help absorption, is a big one. Ginger, tart cherries, and those omega-3s again, like from fatty fish.
And these can help calm things down.
They can potentially help manage inflammatory responses, maybe with fewer side effects than some medications. But it's always wise to chat with a doctor or healthcare professional before making big changes or starting supplements, just to make sure it's right for you. Good advice. Okay, so we know the signals, we know some ways to help naturally, but when is it absolutely time to call in the professionals? Let's cover those SOS signals again. First, inability to bear weight. The knee is shouting, I'm seriously injured.
Yes, that's an emergency signal. If you cannot put weight on your knee, it strongly points to a major structural problem, maybe a fracture, a bad ligament tear, something serious. Needs immediate medical attention, period.
Right. No trying to walk it off.
Yeah.
Second SOS, visible deformity. The knee saying, my architecture is compromised.
Again, not something for home care. If your knee looks obviously out of shape or misaligned, that's a structural issue needing a professional evaluation. Self-treating won't fix the underlying problem.
And the final one, which might creep up, progressive symptoms. Knee saying, this is getting worse, even if you're trying to rest it.
Exactly. If the pain, stiffness, swelling, whatever it is, just keeps getting steadily worse over time despite you trying basic home care, that's a clear sign something underlying needs diagnosis and proper management. Catching it early can often prevent much bigger problems down the road.
These are really crucial red flags. So
Yeah.
wrapping this up, it really feels like our knees are in this constant dialogue with us, doesn't it? From those little creaks to the big SOS signals.
It truly is a lifelong conversation, isn't it? Starts when we're kids, continues right through. And understanding these signals, well, it's not just about feeling better today. It's fundamentally about keeping our mobility, our independence for years to come.
Yeah, absolutely. By really listening, we can respond thoughtfully. Maybe it's changing a habit, maybe it's doing some gentle exercise, or maybe it's knowing when to ask for expert help.
Exactly.
You know, one source put it so well, our knees aren't just complaining. They genuinely want to support your journey, help you get to all the places you want to go for as long as possible.
That's a wonderful way to think about it.
Yeah. So by listening and caring for them, you make sure that vital conversation keeps going, supporting your future. And on that note, that brings us to the end of this deep dive.